life is invaluable and precious. The problem of sudden cardiac death is a major concern all over the world, and it affects people in different age groups. In India in particular, the problem seems to have escalated because of changes in lifestyle and food choices. When medical emergencies like a cardiac arrest happen around a person, it's important to be prepared. If you're aware and informed and you know how to take steps, you can revive a person and save a life. Now, worldwide, millions of people are dying of cardiac arrests every year. This is partly because of limited and sometimes ineffective bystander cardiopulmonary resuscitation or CPR. Adults in cardiac arrest can be revived with their neurological functions intact if bystanders provide immediate CPR, which is why raising public awareness and understanding of CPR is an essential strategy. Well, as always, joining us on Save a Life, which is an initiative through which people are being made aware of the early signs and symptoms of cardiac arrest, are medical experts. Today, we're being joined by Dr. B. Ramesh, consultant cardiologist with the Ramesh Cardiology Clinic in Bengaluru, Dr. Mahantesh R. Charantimath, who's a senior consultant and an interventional cardiologist with the Tathagat Heart Hospital in Bengaluru, and Dr. Shrikant, who is senior consultant and head interventional cardiology with the Sakra World Hospital, Bengaluru. Let me begin with Dr. Ramesh. Dr. Ramesh, now the increasing prevalence of sudden cardiac death has made it a major global health problem. But what are its causes as we understand it now?
The causes for sudden cardiac death can be divided into two groups. The sudden cardiac deaths that happen in young individuals, children and adolescent and teenage groups, while they are playing games or while they are active, trekking and jogging and participating in a sports activity, they may die suddenly. This could be because of the various congenital problems, various we call it as rhythm abnormalities that are inherent, genetically dependent problems. And also they can have congenital diseases like valve problems, aortic valve stenosis and hypertrophic cardiomyopathy, which are all undetected. So this can lead on to a sudden cardiac death while participating in a sports activity, especially in endurance sports activity. That's why all these children have to be screened for any cardiac abnormality by an ECG or if necessary an echocardiogram before we encourage them to take part in these endurance activities. Second group of patients who develop sudden cardiac death is adults, elderly people who have developed what we call as this coronary artery disease, heart attack, and because of or some cardiomyopathy where heart muscle is not functioning properly. The patients with this pre-existing problem like heart attack, previous heart attack, who have undergone angioplasty, bypass surgery, who have a damaged heart, they are at a very high risk of developing tachyarrhythmias, that is various heart beating variations. This can lead on to a sudden cardiac death while participating in a sports activity or even at rest also. Sometimes sudden cardiac death can happen. So all these patients who have a documented heart disease, either in the form of previous heart attack or reduced heart function for any reason, they should be screened for the risk for developing sudden cardiac death, and it can be prevented by various modalities of treatment that has to be adopted.
Dr. Shetty, if I can bring you in, cardiac arrest and heart attacks are seen now quite commonly in young people. Can CPR help to reduce fatality rates, especially when cardiac arrests affect the young?
Absolutely, like you pointed out right in the beginning, time is of very high importance in patients who have had a cardiac arrest, and when patients have cardiac arrest out of hospital, because the resources around them will not be adequate, survival is uniformly poor across the globe. However, the situation is much worse in India because it has been seen that not even 2% of the patients who have out of hospital cardiac arrest receive CPR, and therefore what we call the chain of survival that does not get activated, and eventually only about 3% of those patients survive to complete neurological recovery. And even in the other 8% who manage to live, they survive with very severe neurological damage. And if you compare this with the Western data, where at least 9 to 10% of the patients manage to survive with complete neurological recovery even after an out-of-hospital cardiac arrest. So there is a lot that is left to be desired in trying to improve the survival of out-of-hospital cardiac arrest patients. And the most important thing that needs to be done is creating awareness and education amongst the general public. Because if people are trained in at least basic life support, which they can initiate if they are a bystander to an individual who's had out-of-hospital cardiac arrest, then we can at least hope to improve the chances of survival in that individual. So unless we initiate immediate CPR, there is a rapid neurological deterioration in these patients. Brain cells start dying within minutes of stoppage of circulation. Therefore, at least by doing effective chest compressions, we can ensure that there is circulation that is reinitiated to the brain, and we give the person a chance of survival. However, BLS having been initiated, the people have to also call for additional help and call ambulance with trained paramedics and doctors who can come and take over the resuscitation and initiate what we call advanced cardiac life support. Once that is done, the chance of survival in these patients can improve. A cogent example was that of footballer Christian Eriksen, who had an on-field cardiac arrest, and because there was availability of trained paramedics on the field, he could survive, and now he is back to competitive sport even after having implanted a defibrillator. So this is a beautiful example of how bystander CPR can help survival.
Right. Thank you very much indeed for sharing that. That indeed brings us a lot of hope. Dr. Chirantivat, it's said that men are significantly more likely to have their heart stop suddenly compared to women. Is this true?
Yeah, it's true. In general, the cardiac deaths are more common in male compared to the women, because of males are more exposed to the more having high risk factors, and also more environmental risk factors, and also they are having like coronary artery disease, hypertension, diabetes, high risk behavior. I think most of the people you come across the examples, whether it's Puneet Rajkumar, Shukla, KK Singh, as the Christian, Derrickson, all are male only, I think. But nowadays also, because of change in lifestyle, women's also catching up with men in getting the heart attacks and also sudden cardiac death. The sudden cardiac arrest is a sudden cessation of electrical activity. Is different from the acute attack. The heart attack is also one of the reasons for the sudden cardiac arrest. So as my colleague mentioned, sudden cessation of the electrical activity could be reasons of various reasons. One of them is acute heart attack, or we call them as the sudden cardiac arrest, sudden cardiac death, and because of change in and that too in India, more than about 10 to 12 lakhs young people are dying suddenly because of the sudden cardiac arrest, and is a huge economical burden, and also part of creating social issues, economic issues in India. I think we need to change our lifestyle, and adopting a healthy lifestyle we can prevent this, and also bringing a lot of awareness among the men, and also about our high risk behavior, risk factors like smoking, alcoholism, and physical activity, sedentary lifestyle. I think by modifying all this, our men can be, have better healthy life, and can have the lesser incidence of this the sudden cardiac arrest and cardiac deaths.
Well, interesting that. Dr. Ramesh, does CPR apply in both conditions, cardiac arrest as well as heart attacks?
See, heart attack is a situation where patient has a chest pain and intense chest pain and profuse sweating, giddiness, and he has to be rushed to a cardiac department, cardiac emergency, where he will be treated with diagnosed with an ECG, cardiac markers, and do an angio. All those things will happen for a patient with heart attack. That's why the cardiac arrest happens in first 2 to 4 hours of onset of chest pain in any patient with a heart attack, and 90% of the deaths because of the heart attack happen within first 4 to 6 hours of onset of chest pain. That's why this is a golden period, we call it as. That's why any person who is having a chest pain, ongoing chest pain with a typical symptoms, they have to be rushed to the hospital, and thereby rushed to the hospital and a emergency department, and this cardiac arrest can be treated effectively if at all it happens. The cardiac arrest, as Dr. Mahantesh said, it is a sudden stopping of the heart beating. This happens in patients with heart attack, and it is responsible for death, majority of the deaths in patient with heart attack. This is one thing. Second thing is the cardiac arrest is different from myocardial infarction, because myocardial infarction patient is stable. Sometimes he will be stable, only he can suddenly deteriorate to develop a cardiac arrest. That is the main difference. And also patients vulnerable for cardiac arrest are those who have acute heart attack, and also who have already had a heart attack or damaged heart because of the heart attack, damaged heart. So heart function, whenever the heart function is reduced, they are at a high risk of developing sudden cardiac death, and they have to be investigated, they have to be treated. So heart attack is different, and the sudden cardiac arrest is different. But the patient with a heart attack, they are at a high risk of developing sudden cardiac death. That's what I want to emphasize.
Right. Dr. Mahantesh Charantibat, what steps should a bystander follow if he or she recognizes that a person is having cardiac arrest?
Yeah, anybody is bystander. He need not be trained also, because doing something is better than nothing. So if you see anyone falls, and look for whether he is conscious or not, is there any body respiration, breathing, and immediately you should initiate, because the CPR is basically a bridge to survival. Because if you don't restore blood flow within 5 to 6 minutes, the brain will be dead. So as soon as someone, and look for the call for the help, and immediately call for the help from the emergency call to the any ambulance, and also looking for this thing. And first is to look for the circulation, breathing, and this chest, because initially we should, as soon as suddenly sees, you should give a thump on the chest in the nipples, that is between the on the center of the chest, and he should keep his hand straight, palm, heel rest on the chest, and one over the other should start compressing at least after 100 to 200 compressions per minute. And after every 30 compressions, he should try to breathe. Check, he should lift the chin and see that is there any obstacle in the dentature and in the mouth, and after that you clear it, and mouth to mouth breathing or holding a palm, and he can breathe through fist of his hand, and meanwhile call for the all emergency, and emergency, or and in case any access to the, if he is trained well carrying any AEDs, you might have seen the automatic electrical defibrillators. What happened? Paramedics carried to the Christian Erickson, where he revived. It could be revived. Similarly, can give the shock. Sometimes loud thump itself can act as a shock. It can revive. It can it can restart the heartbeat. And by doing this, and it also depends whether you are alone, whether you're with the two guys or with the paramedics, and depending on that, you can try to search for his mobile, call and initiate, and every 30 compression he should breathe twice, and keep on doing it till maintaining it will help to maintain the restore the blood flow to the brain and the various vital organs, so that the patient can be keep him alive, so that till you get the advanced medical emergency equipments come in, and the patient can be shifted, or we can make him survive. And it is very important. And if your heart rates, shake the body, make him call his name, or try to talk him, and so that he is responding or not, is not responding. Look for the pulse or any breathing, chest movements, or so that our eyeball movements. Look for the pulse. So this is very, very important. Doing nothing.
Right.
Doing something is better than doing nothing, because sometimes by shaking himself, person can revive. And we have seen the people coming with Just I made him walk. I made him compressed. I shaked his body. He could be able to get up like that.
Right. All right. Thank you very much indeed. We will take a quick break at this point, but be back with lots more. Also, exactly what bystanders should do in a situation like that. We get you details in a moment. Welcome back to Health and Wellness Save a Life. We've been talking about cardiac arrests and how to intervene in such situations, and also the importance of cardiopulmonary resuscitation or CPR. Let me go across to Dr. Shetty. Now, Dr. Shetty, how would a bystander, a non-medical person, know if he or she is doing CPR with the correct technique? What are the main steps, if you could run us through those?
Yeah, first of all, I think it's everybody's duty to be trained for proper BLS, at least, because someday you might get to save an individual's life. First thing is, you have to recognize that this is cardiac arrest, because every unresponsive patient, unconscious patient is not cardiac arrest. For example, if somebody's got low sugar, he or she could be unconscious. So you don't need to do CPR in that situation. So how do you recognize cardiac arrest? So you should look for 3 cardinal signs. One, whether the patient is unconscious. So you call out, shake the person and see whether the patient is unconscious. 2, look for signs of breathing, chest movements or other breathing activity. 3rd, look for signs of cardiac activity. That means listen to the chest for heart sounds, or if you are trained to look for a pulse, look for the pulse in the neck. And if all 3 are absent, it means that the person is in cardiac arrest. Then you put the patient flat on his back and push his chin forward so that his tongue doesn't fall back, and close his airway. Also see if there are any immediately correctable signs of airway occlusion, like if the person has been having food, if he's choked on food, so you have to clear the airway quickly. And if the airway is clear, then you start doing cardiac compressions by kneeling onto the right side of the person and using the heel of one hand and using the support from the heel of the other hand with your fingers locked, and then you start doing effective compressions of a couple of inches of movement of the sternum, and you are compressing at the lower end of the sternum, and you have to do this at least close to 100 times a minute. Now, like Dr. Charantimat said, you could also give intermittent mouth-to-mouth breathing after every 30 chest compressions. However, this is not mandatory, because these days for basic life support, we only recommend hands-only CPR, because you should not interrupt the cycle of compression. And when you compress the chest, the movements of the chest so generated itself will act as the respiratory movements, and to some extent help with the gas exchange in the lung. So you should not interrupt the chest compressions, and because the longer and continuous compressions are more effective in achieving return of spontaneous circulation. And simultaneously, you should ask somebody to get additional help, like I earlier mentioned, because just chest compressions for a long time, the chances of survival goes on reducing, because it is found that more than 30 minutes of CPR needed, then the chances of survival are very, very poor. So there are situations where there is what we call a shockable rhythm, like rapid heart beating with ventricular tachycardia or ventricular fibrillation. Here, initiation of ACLS improves the chances of survival significantly. So asking for additional help also becomes very important. When you are doing effective chest compressions, sometimes you will see that if it is an early initiation of CPR, on restoration of the blood supply to the brain, intermittently the patient will show signs of life in terms of limb movements or being awake. But if spontaneous circulation has not returned, the moment you stop the chest compressions, the patient again falls back into unconsciousness. So you have to continue chest compressions till help arrives.
Right. Dr. Ramesh, what are some of the complications then that are associated with chest compressions? Would you like to add to what's already been discussed?
Yeah, see, the complications could be because of, vigorous chest compressions. The patient can develop rib fractures, and sometimes injury to the heart can happen. But these are all very trivial issues. If you can save a life who has a cardiac arrest, and bring him back to life, these complications are negligible, I would say. And I would like to emphasize most important thing is one is the public awareness of a cardiac arrest. How all of us can be trained to resuscitate a person who has a cardiac arrest, and how to recognize it. This should become a public health movement, I would say, so that number of areas, key areas where this crowding is there, there has to be some mechanisms where we should have volunteers who can perform this. Second is the modalities where we can bring these patients with a cardiac arrest back. Availability of a defibrillator in public places, and availability of emergency nursing staff who can come in 2 to 5 minutes, 10 minutes, 15 minutes, and give a defibrillator shock and convert this fast heart rates back into the normal this rhythm. They all make a big difference. And the public awareness and availability of this infrastructure should be created in all public places and crowded places. That's what I want to emphasize.
Right. Dr. Chirantimath, what precautions should existing heart patients take when they are traveling?
I think it's very important, because once they are aware about got the heart issues, they should be connected immediately. So they should have some emergency contact number to be kept in their pocket, or they should not lock their mobiles. And also they take emergency medications like the isodil, sorbitrate, or glyceryl nitrate, so that whenever they get a chest pain something, and they should take either sitting or standing down. And also they should take some medications to bring down their breathlessness and all, like breathing difficulties like Lasix and all. And always they see that they should not indulge in vigorous physical activity when they go out. They see that they should know their limits and they should not exert too much. And wherever possible, they can use, in case they got, most of this cardiac arrest can happen in people with weak heart. So, so in such scenario, they should minimize their physical activity and also take necessary medication, communicate, and be in touch with your respective doctors or the family and family friends, so that you can always be traceable. And so these are the certain measures. And also you see that you wherever possible, you can use the lift, or you can use the wheelchairs and all to minimize your the patient the physical activity.
Okay, we leave it at that. Thank you all for joining us and shedding so much light on what is such a crucial issue indeed. To all our viewers, thanks for watching.